So today is really, these are the outcomes of today. What we wanted to cover was reflecting on what we learned about culture during the pandemic and some of the lessons learned that we captured. Really, culture development is really thinking about mindsets and behaviours for collaborating and assistance. So we're going to explore some of that. What is the impact of good leadership and culture in our integrated care systems? We've got some resources that we can share that will help you understand how we might measure and promote healthy cultures. And also, more importantly, we've got 190 people on this call. There's an opportunity to network across the country with other leaders who are really grappling with this topic and seeking to understand how to build good culture across systems. Next slide, please. So the agenda today, I'm going to talk first about the learning that HSN Network gathered about culture and leadership during pandemic. We have Jill Fazy, who's an OD and Leadership Associate with Cheshire Merseyside ICS, who's going to talk about working in systems and the behaviours that help us navigate them. We have Maria Smith, who's a Senior Programme Lead from the Leadership and Learning team at NHS England. And we're going to look at the work around the clinical and care professional leadership that they have been leading and the role of culture in that. And then we have two of my great colleagues, Wendy Burton and Natalie Latham, who are going to bring some content about culture, what we've been learning in our own system as we have been investigating what needs to be done. So there's a bit of action learning and sharing the results of that, but then also Natalie's going to lead us in a session of some resources that are already out there available to us that can help us measure and plan for health cultures in a system. Next slide, please. So before we start, I just wanted to ground us in I was looking for a definition of culture, but I think I really like the work of Julian Stodd and ground us in this understanding that culture is complex. There's no one silver bullet. There's a number of things that we can do to influence culture, but culture is co-created in the moment. I really like that. So culture is experienced by different people at different times. So one people can experience a culture in a team or an organisation differently from another. And that's through the actions of every individual and the stories that we tell within organisations. It also operates at a cognitive level. And I think we're going to explore that a lot today about mindsets and the paradigms, the reality of how we see the system. So what we think and how we think impacts us at the behavioural level. It drives our behaviours and our permissions. And just an understanding that we can't fully control culture. There's a number of things that we can do that will allow us to have marginal gains and influence culture, but it's an ongoing journey. It's not fixed set in time. Next slide, please. Excuse me. So just taking us back a year, our first culture camp was back in March, and we covered, at that time, we were coming through the third wave of pandemic, and again, we put on our culture camp, but we thought everyone's so busy, are people going to be interested? And we were just really overwhelmed by the hunger for learning about culture and sharing some really great work that was going on in our own region. So we had a focus on innovation, mental health and well-being, and equity and inclusion. All the recordings for these sessions are on our YouTube channel, Innovation Agency YouTube channel. So if you want to rewatch those or watch those, please go there. Next slide, please. But today, a year on, or over a year on, Culture Camp 2, we are having a focus on culture and integrated care systems. A lot has happened in the last 15, 16 months. We've had, we had the vaccine rollout. We are coming out of the pandemic, beginning to live our lives more normally. We've had a change of prime minister. There's been a change of government in the US. There's a war in Ukraine. So much happened in that time. And, on the 1st of July, the integrated care systems became a statutory being. And really the, integrated care systems are set up to bring organisations together in partnership to jointly work together to plan and deliver health and care services in a region for the people who work and live in that region. So for the first time, there's a mandate and a statutory obligation for organisations to work together. And so the challenges of bringing different organisations with different cultures is really something that we're all grappling with. And interestingly, the NHS Concept released a report in February about the state of integrated care systems, and this really struck me about, they recognise that the success of systems will rely mostly on the kind of culture that develops between the partners in each ICS. So how they're experiencing culture, how they feel they're welcomed or belong or able to collaborate. And collaboration is difficult, it's tricky, and also means that you may have to sometimes give up part of what your organisation is doing or gaining in order for the greater good. So there's some real challenges in terms of culture and in terms of leadership. Next slide, please. So I'm just going to talk a little bit about learning about system culture and leadership during crisis. So next slide, please. So I'm just talking a bit about the work that HSN Network did. We are one of the 15 academic health science networks across the country. And back in January 2021, we did a piece of work where we wanted to gather a lot of ICS, a lot of health and care partnerships at that time in their infancy were working to gather lessons across the regions, and a lot of HSN supported some of that. So we were looking at the impact on workforce of the pandemic, and part of that was around looking at culture. So we did a lot of interviews with local leaders, focus groups, rapid insights, and we used the Bird Bridge model, which is what should we let go of, what should we amplify, what we put in that we need still and should keep, and what should we let discontinue. And then also the Iceberg model as a framework. And I really wanted to talk about the value of an Iceberg model, looking at a system and using it as a system to understand the system and where to intervene in a system in order to affect change. Next slide, please.
Juliette.
Hello.
Hi, it's Wendy. It seems that a few people are having some problems hearing you. There's a bit of an echo and a bit of mutedness on your sound. I wonder if it's because you're moving towards and away from the mic. So if you stay closer to your mic, it might help.
Yeah, sorry about that.
Sorry.
That's okay. I'm hoping it's not my internet. I'm just going to mute and unmute myself. Oh, maybe that'll help. Some gremlins. Is that any better?
It's okay for me. I think it's just, I'm noticing as you're moving, as you move away, the sound gets a bit less, and some people are struggling a little bit with it.
Okay, I'm going to stop moving the hands and doing that. So I just wanted to talk about this work. Helen Bevan, I was at a session with Helen Bevan recently, and she brought this work about understanding systems. And Donella Meadows was an American environmental activist and worked and did some studies around, wrote a book about thinking about systems and also how we affect change in systems. And she came up with these 12 leverage points in a system for places to intervene in a system, and so in ascending order of effectiveness. So typically, we will see something happen, an event will happen, and often we will change the process, and so we might change the parameters, or we might slow down the flow or increase the materials that's needed in that part of the system. And that will affect a change, but it's not often a sustainable change. Then, as we go up the leverage system, the next things that we can intervene at is looking at the feedback loops. Stop doing that, start doing that. The information flows that we release or hold on to, and the delays that we can create in the system that can help control the system. And that again can affect some change. But where we get some real transformational change and empowering people, because often we tell people what to do, they'll do it, but after a while it'll drop off. But actually engaging them in at the social system effect and thinking about what the goals of the system, being really clear about the goals so people can follow them, having simple rules in the system so people can navigate them. But real transformational change, or the biggest effects, is really about helping people to see the system in a new paradigm as such, or a new reality. So really working at the mindset level. And if so an example of that is, years ago people used to think the world was flat, and that was their paradigm, that was their reality, until science and we measured the world and we were able to prove that actually the world is round. So their paradigms can be changed all the time, but it takes a work at the mindset and the mental model level. Next slide, please. Thank you. So the Iceberg model is a great way of looking at all the perspectives of a system. And Donella Meadows talks about we need to, the impulse is often to, our first impulse of where to fix the system is not always the right one. So there's we need to do some deep thinking to take a step back to look at all the levels of the system. So we're looking at the events, what we've actually seen. Often we can do some quick fixes there, but beneath that, we need to look at the patterns, what's happening, what's the data, what's the trends, where are we seeing things, and then we can start to forecast and predict. Then even beneath that, the structures drive the pattern. So that can be buildings, it can be capacity, resources, policies, the rituals that we have. And then finally, the mental models that we hold, the worldview that we have, the beliefs that we have about the system drive the design of the structures, that drive the patterns, that create the events. So intervening at these different levels will give you different changes, but some of them more transformational if you go right down to the mental model level. Next slide, please. So if we're thinking about that in terms of what we were observing across our network, looking at capturing lessons learned, down the left is the Donella Meadows change, where we could affect change. And then the first column is really about the Iceberg model. So what did we see? We saw an increase in the use of digital technologies in clinical services at scale. Now, for years, if we were just to, and for years, we've been just working at that level. We've been putting in digital services. People haven't been using it pre-COVID. There was a lot of committees. My husband's a doctor. He tried to introduce telemedicine and neurology services back in 2017, just couldn't get the traction. The rewards and incentives were not there, and the intrinsic motivation and the mental models, or the paradigm to use services or to deliver services in that way wasn't there. It was beginning to grow, but it was just not there. Then looking at the patterns, we saw people staying away from hospitals and GP surgeries. People were scared, if you remember that time. It was really terrifying. People were working from home at scale. There was an increase in waiting lists and backlog, and a subsequent, as we know now, backlog. But we also saw increased collaborations and increased people wanting to join the care profession. So at that time, a lot of people were motivated to help and to support the care system. And what was in place at that time was just, rightly or wrongly, we refocused priorities. We stepped down a lot of elective care because we had to, in order to free up the capacity to deal with the onslaught of COVID. But there was clear leadership, clear goals. We developed a cell structure in our region, command and control, with very simple rules, hands, face, space, you remember that. And our priorities were refocused. So that really helped drive the system. And then, but really what emerged was the work remotely paradigm, the reality for clinical specialties began to emerge, and it began to be the worldview. So people knew that they had to collaborate, they had to keep people safe, and to do that, we had to remove, the face-to-face contact. So there was a real shift which drove the whole system, and as a result, we have we saw a whole-scale use of digital technology and community services at scale. And we want to take some of that, or most of that, because I think it's, it has brought about better access, better work-life balance, etc., etc. So next slide, please. So when we talk about paradigms or our mental models, I just thought it'd be good to just take some time to really reflect on that. So a paradigm is a set of assumptions, concepts, values and practices that constitutes a way of viewing reality for the community that it serves them. If we think about the paradigm of the ICS system, what I would like you to do is just take some time in breakout rooms to reflect on paradigms and what it means for you. So what are the assumptions and concepts we're holding at this time about the culture and leadership in our system? What do we think is needed to take the next step for the development of culture? And I don't know if you've heard of liberating structures, but we don't need a perfect answer. We need, let's think of just the 15%, the next step. So what I would invite you to do is to go into your breakout rooms and to introduce yourselves, meet some new people, and have a discussion about the what paradigm you think is existing currently. And this is a snapshot in time. It's not the reality for everyone in your systems. Welcome back, everybody. It may help if you turn your cameras off just with the sound, with the bandwidth, so if people are struggling. Sorry it was so quick, the breakout room. We've got a lot to get through today, but we will be having another couple, and it's good. I think the networking opportunities are as valuable as the content. So just to say as well, I didn't say before you went into the breakout rooms, but it'd be great to capture some of the high-level themes that you were talking about in those rooms. So if you could put those into the Slido, that'll help us capture the themes, and it will really help us think about our next culture camp as well, and what content we can bring that will be helpful to you. So I just wanted to offer this model as our culture model. It's something that we have developed at the Innovation Agency through our work on our culture programs and in systems. It's a model of lots of models, but we just pulled this together through our learning. So building culture or looking at culture takes a focus on people, mindsets and relationships, but also systems and strategy driving the culture and sustainability. So taking a longer term view and looking at the wider systemic impacts of what we're doing. Next slide, please. And then when we are looking to build culture, some of the things that you might focus on and put in place, the practical things that you might do, are looking at how we are developing people through the PDR processes. They're balancing skills with dispositional growth. So it's not always enough just to know how to do something. It's about how are you doing it, how are you living in the world while you're doing that, and that really helps to build the culture. I've also scored out organisational development for network development as we're moving into the new world. The value placed on the relationships and the networking that we do is really important in building system culture and allowing people, particularly as we're going to be working across organisations, the permissions and the support to work and have that time valued is really, really important as well. So as I say, this is all going to be available to you after after today, and I'll let you reflect on that.